too much pressure, I think. I don't know.
Okay.
You do?
Maybe I'm pushing at the same time.
Yeah, it's a bit painful. I think it's just sore. Yeah. That's funny because I'm left-handed.
Great, so revision, yeah? Weekend 5, we're starting with a revision, and we will start facing up in the supine position because usually we leave it to the end. So we'll do now other techniques first. Okay, so towel technique, as you've asked, taking the tea towel. This one is a really big, I mean it's a fleece and really nice to use, isn't it? Who uses fleece at home? Yeah, it's really, really good. And they're quite cheap. Yeah.
£5.99.
£5, isn't it? So it's cheaper than a towel. It dries quicker and it's very fluffy and warm. And good choice, really good choice. Okay, so towel technique, you do that above. On the front, I don't tuck the towel under and I just leave it like that. Yeah. Usually I will fold it just because I need now to treat the leg. Yeah. Okay. One thing I would say, what I see sometimes is that students really just do something like that when they moving the towel. So first of all, move the towel right away and with a nice crease. Yeah. So just try to avoid this kind of mess, yeah? It will be easier, the towel would be cleaner. Okay, anything else I should change?
Isn't the
pillow?
there?
Yeah, how's the pillow? Right place?
Yeah.
Good, thanks. Anything else?
Maybe her hair.
Sorry?
Put on her head.
Yeah, maybe the head, yeah. Anyone has a towel? Yeah. What I have in my clinic is that I use towels, yeah, and because I can fold them and open, yeah. Is it better? Yeah. Okay. Anything else? Yeah, I have. Anything else?
Too stretch.
What about her hair? Was it not
I stretch. Okay. Anything else?
her hair?
Hair. Yeah.
Oh, no?
Good. Good. Let's see how holistic you are in your thinking.
Are you alright?
I'm all right, thank you. Are you all right? I'm fine. Yes. Okay. Look at her face.
What about the eyes?
Yes. Do you see that the light is coming from above?
Yeah.
Yeah. You have to think really holistically. You can't just say, yeah. So actually, can someone? Well, someone have sunglasses? No, but I'm joking. But you have to think for them at times, yeah? You have to think for them and look for what will be really not good or good. Okay. So,
What would you use for the eyes then? Would you get an eye patch? Or
you can use the eye, the one that we do it in class sometimes, games with, yeah? iPhone, yeah? Sorry? Sometimes you turn the whole light, so at times you have no control over the place. If you turn the light, oh fantastic, if you can do that. And it's better to have a side light, not a direct from the ceiling.
Those up lights that you put behind small pieces of furniture and stuff,
Yep.
aren't you? On the floor when they light up.
So kind of, well, I call it still a side light because it's on the side and it lit
from
below up. So very little, and nice one with a dimmer. Yeah, you can do wonderful things with 20,000 pounds. You can have really nice practice. Yes, everything. Yeah, really good. Okay, so I would concentrate now on the legs. You will need to help me with muscles and the effect of what I do. Yeah, with two things. It's important to have knowledge of the muscles and what do we do, because it will help you with your massage recommendation that I find still the weakest link in your homework. Okay, so I'm going to use today a wax. You all received that, and this one is a songbird sport massage wax. Wax is good. First, it's natural. You need very little of it, and it warms up the muscle really nicely. What therapists sometimes do is this: they take a little bit of it and they put somewhere here. And if you need a little bit more, you just come and pick it up from here. So actually you can forget about, because you don't need so much, and it just stay there. You can just take a little bit and you can start working. And every time you need a little bit more, you take it from here. Yeah? Okay. So hold, right? Right. Remember the hold I've showed you yesterday? That hold? Not nice. You really need to stay there and hold yourself. If anything, yeah, you hold yourself. Good. Do you have to continue with any technique after?
Vibration.
You can do vibration, you can do effleurage.
Okay.
I wouldn't start with compression, but you can start with some oscillation. Okay.
When would you use that?
I don't know, whenever I feel. Okay, I give you an example. I've talked to one of the examiners about it. Okay. Imagine you have someone really big with big muscles, body trainer, weightlifters, and they come and they want their leg to be massaged because they have a competition. And you think, you know, even if I do compression, it's going to be very hard. So you need to have a more general effect on the whole of the muscles. Yeah? So this way, you're using wisely what you can do to allow a full treatment of the legs. Yeah? You're relaxing the joint here. Sorry. You're relaxing the joint here. You're massaging the muscles, you're moving the muscles, you're increasing the blood circulation. Okay. You can do it this way. Vibration. Yeah. Or percussion. Yeah. How is the pressure? Yeah, it's okay. So I know that it's not very common, so I would need to be sure that this is in good shape for her.
If somebody wanted to come just to have a relaxing massage and they had a bit of pain in their leg, and
I wouldn't do that.
You wouldn't
I wouldn't do that.
Exactly what I need, actually.
Yeah?
Yeah.
Okay. I want you to try that. So when you're starting, try all this technique because I want you to feel it. It's not correct that you have to start with effleurage.
That's some good feedback when you do that stretching.
Yep. Yeah.
Yeah,
You can do that in here. It's a lullaby. It's really relaxing. Yeah.
Is that just on the back and not on the stomach?
You can do it on the stomach as well. Okay. Right. Are we ready for effleurage? Yeah. You're taking the towel in two places. You're moving it in here, and then you tuck it underneath. That's it. Yeah. Come closer, please. Come closer.
I can't see it.
You take more of the wax. Now, the good thing about the sport wax is it gives you a nice grip. You're not gliding. Yeah, I need a little bit of that. I go with scissors. Sometimes I use this a lot, and sometimes I use pure wax. You can put that in here. Right, so the most important thing for me in effleurage is that you're gliding, your leg movement, yeah? Be sure to do that. I have some not so nice ideas about what if it doesn't work. And one of the things is to buy some, you know the broomsticks, and to put it on the back. So you have to have a straight back. You can't. It's really not nice. So don't let me do it.
Just for the height of the table, where do you recommend?
Yeah.
Because
Out
I did that and
Yeah.
I felt the table was too low for me.
No, it should be okay. It should be that you're actually moving
Maybe
from your leg. You're not moving enough from your leg. Yeah. Okay. So muscle-wise, yeah. Which muscle I'm working now on? Quadriceps. Good. Where does it end actually? Does it end above the knee or below? Below the knee. And does it go? And it goes all the way above the hip, or
No.
some above, some below, some above and some below. And what's the action that it does? I need either flexion or extension more than just that line.
Knee extension.
Knee extension and hip flexion.
Hip
Hip flexion and knee extension. Okay. Can you do that? And can you feel the muscles in front? No, straighten your leg. Do you feel it?
Yeah.
Good. So you know it.
And hip.
Okay. So, okay. Let's come back to the effleurage. What's the effect of the effleurage? Warm the superficial muscles.
Increase the pressure.
Increase circulation.
Relax.
Relax. Absolutely. Put the spread the wax. Yeah. Anything else?
And get out the waist.
Sorry?
You know, it's taking out
The waist through the circulation. Yeah, yeah, yeah. So take the waist, bring more oxygen,
and nutrients.
nutrients. Good. That's it. Write it in your note. Very simple. Okay. Good. Effleurage can be quite superficial, or you can do it quite deep. Here you see that I've just spread my fingers and just go really kind of a little bit deeper in. Good. Right. After that, Petrissage. What kind of Petrissage is this? Ringing would be like kneading or alternating hand. Yeah. Any other, Christina, do you remember any other Petrissage?
Ring.
Ringing, yeah, okay. So ringing would be like that. Right. Look at the body. A lot of you would just do it this way. No. A lot of movement. It's actually kind of natural falling and then the hand just moving with it. Yeah? What else? Other Petrissage?
Knuckles.
Lifting.
Yeah.
And you can do the lifting and squeezing together. Yeah? So squeezing would be just squeezing, or you need to lift, you need to squeeze as well. Yeah? You know what? It's not important that you describe that. I just want your hands to know it. So I don't want in the exam to start squeezing, lifting. Petrissage. This is the general name for Petrissage.
I don't know that you're going to be doing those.
So, but I want your hands to know it. Yeah? Finger kneading. Yeah? Good. And once in a while, effleurage as well. So posture, very, very important posture. Yeah? How's the pressure? How would you describe this effleurage? Is it light, superficial, deep?
Deep.
Quite deep. Yeah. So you know it's quite deep because look at my weight of my body. Yeah. Superficial, I would do that. I lean. That's how I know what you do before just by looking. Yeah. Okay. Good. On the leg, you have one muscle in front. On the side, tibialis anterior, yeah. And what this muscle does is does this movement. Can you come and see it closely? Do it again. Yeah. Yeah. And relax. Good. Again, without lifting. Yeah. 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 You can see it here and relax. Yeah. Do it again. Yeah? You see how my finger pushed out, yeah? And relax, thank you. Promise not to interrupt you anymore.
What's it called?
Tibialis Anterior. Or it's on the tibia as in front. Yeah? I like to, it's not a big muscle, so what I like to do is work with my thumb. Just like that. Reinforce thumb.
What would be an alternative if you don't like using the thumb?
Actually, I don't use my thumb. I use this finger, this hand. The thumb is just there.
Oh.
I don't press with it. It's just like a stunt, like a...
Just like a groove.
Like a groove in that, and all the pressure coming from this hand, not from this hand.
Because it could be quite uncomfortable if you're...
Yeah, if you're pressing. I don't do that.
No.
I leave it completely neutral.
Just got something to go.
And this is the groove that it goes in, yeah?
And that technique is?
Petrissage. It will be petrissage. You can do it with the knuckles as well. But be aware that it can be very painful. I call this the tourist muscle. Because people with most problems there are those who work with flip-flops. Yeah, because they need to kind of contract that and control that. So a lot of, when you walk on the beach, on the sand, also, it's kind of tender. It can be tender. So knuckles. Knuckles. Don't look for tourist muscle in, on YouTube, because, or the virtual campus is not going to be there.
It's your nickname.
Yes, nickname, exactly. So knuckles.
How wide is that muscle? Like,
That's it.
start and end?
So it's quite a long thing.
And it's long. It's long down to here. And then it does something funny. It goes and crosses to the other side and attached here.
Wow.
Yeah. It's a kind of...
So would you follow it down to that?
Well, you can't... yeah, you should. You should follow it down to here. Yeah. Yeah, down to here. Or if you're... If you want to be precise, yes, you would also massage this area. Would be good. It's nice to massage the whole length of the muscle, especially the attachment to the bone, really, because it's where a lot of sensitivity is. Yeah. Okay. What else? So we done percussion. Percussion usually I will do on the towel. Yeah. So cupping, slapping, hacking. Yeah. Beating, yeah, good. Vibration, oscillation.
When you wouldn't do oscillation?
When I would not do oscillation, okay, people with, say, a hip replacement, yeah, people who've, I feel that it agitate them. There's some people, it's amazing that you just need to, from the 50 hours you do, just get the sense of what's going on with them. Some people, it's not that it's not good, it are irritate them. And they don't get it.
Yeah, so for someone who really likes a deep tissue massage, isn't perhaps going to get on very well with being...
Actually, I think that actually oscillation with a bit of pressure there could be good, actually, for deep tissue lovers. But there are some people that just like to just be kind of very light, and it's called in Chinese medicine people who don't like wind. They don't like changes. They don't like things to, you know, they're like, give me the same old thing and I'll be fine with. Don't create too much wind or change. Wind is actually changes. Yeah. So people who maybe you feel in the consultation, and that's the art of consultation, not only what we're asking, but also what kind of people they are. Do they like changes? Are they responding well to changes, or it's too much for them? Yeah. So it's actually more psychologically than physiologically.
So like if there was, let's say, hip
there is no right and wrong, yeah?
Or like me some problems, but there was like earlier. So it's still safe to do.
Sorry?
It's not like, let's say, said hip replacement,
yes,
then you wouldn't do. But if there just was some problems, I don't
okay.
know.
Hip replacement, if it's a recent hip replacement, I wouldn't do. But if it's a long term, it might be the things that to do. That's great.
So it's not gonna harm the person.
No.
What about
No.
lower back pain? Is that?
Again, it could be quite good. Yeah, yeah, it can be quite
For
good
back problems as
because
well, yeah.
because it relaxes not only that, but the hip here, the hip muscles, yeah, and the gluteus muscle after that. So we work after.
Which, if you've got nerve entrapment as well.
Yeah, because what you do is actually you I can show you a variation of it, yeah, which is that, and then you just do that, and what now happened is that the lower back muscle is stretching,
Yeah.
yeah. So it's a really nice one. Do you feel it in the lower back? Yeah. And the gluteus muscle also stretch. And then you can just add your hand here on the gluteus to just do more muscle side. Yeah, really nice stretch on the gluteal. On the gluteus maximus muscle. Yeah. Here I now actually feel almost like the sacrum. Yeah.
I think on your seating bone bit.
Yeah.
You are you're not on the spine. You're on the gluteus. So the spine is a little bit above. The spine is here. What I'm here is on the hip itself.
So is there a bone you feel there?
I can feel the sacrum if I go down, but I don't. I just feel the muscles.
Isn't the sacrum in the middle?
No, the edge of it. Yeah, the edge of it.
Can you show the compression bit when you do?
Yep, compression.
Where would you?
Okay. Compression. Yeah. Compression is not about where I would do, but where they need it.
Yeah.
Yeah.
Where?
So, example, you do effleurage, you start doing petrissage, and then you're feeling, oh, okay, I can feel that. It might be, now, let's call it a knot. Now, what is it a knot? A knot is something that you feel or something that they feel.
You feel my facial trigger.
If they feel,
You feel also.
It could be, yeah. What do you think is more important, what they feel or what we feel in terms of note?
What we feel.
Sorry?
What we feel. Like
Actually, it's what they feel.
Because I can tell you.
Yeah, because sometimes you will see people who muscle tense and they have no problem there. So you want to actually go to the tenderness area. So instead of knot, I would call maybe this area tender area. And these are the more area that you need to treat. So it's not so much about what you feel, but about what they report. So if I would say, she would say, "Ow," that would be enough for me to say, okay, let me work and do compression here. Or I could say, do you feel that? Because sometimes it's both.
But you
me
be-
feel and she feel it.
But you'd be feeling the kind of knot.
Sometimes not. Sometimes not.
Oh, sometimes.
Sometimes I would not feel it.
So you was just guessing.
So you just start with it. Now, what happened when you press in? If there is lactic acid accumulation or waste product and you press in, you irritate an area that is just not good. And that would cause some tenderness. So you actually provoking the muscle to create tenderness. And then you know, aha, that's it. It's like doctor, dentist. You go to the dentist and he knocks on the teeth, on the tooth. This one, tung tung, okay. This one, tung tung, okay. This one, ouch, no, okay. He knows this is where the problem is.
Okay.
Yeah. So you actually. That's why sometimes when the client shows tenderness, it doesn't mean that it's bad. It just said, okay, I find it. Now I need to work on that.
But for us, feeling tenderness is generally when we feel the kind of maybe the kind of knotted area.
It's an educated guess. You need to just see what's going on in there and then give it a try. Yeah. Okay. So the application of it, what you find, is a lot into simple pressure.
So now what
And
you're
then-
doing, you're squeezing.
No, it's mostly there. Now, I put the other hand for support. I use a lot of support. So now, for example, what I do, most of the pressure comes
So
with
it's
this
on the-
finger,
okay.
but actually I keep the rest just as a support.
Okay.
It's like,
And you
imagine
don't-
I have pain, the client have pain here, and I do that, but I also kind of confuse the nervous system by doing another place, something that, this is what we do when we have pain and we kind of rub it. We bring another sensation that takes off the pain. So here I bring a sensation of touch, and I don't concentrate just like that, but make it diluted.
Okay.
Does it make sense?
Mm-hmm.
Yeah, good.
So the problem area is under your thumb, right?
No, it's in
Oh,
here.
right, right.
It's in here. You can do it. You can do the same. Now I done the opposite. Now it's the thumb that is in the problematic area, or here. And take it even a little bit into oscillation, very light oscillation. So you take the mind away from that pain.
So what sort of pressure is that?
Kind of moderate, I would say.
Yeah.
Can I go deeper? Is it deep enough?
You can go a little bit deeper.
Yeah.
Yeah, that's good.
And then you would just release or allow the
And
blood
then I
to go
keep
in.
it there. And then I release it a little bit. And then I press it again. But what I would like you to see is my body actually, because it just oscillates every time in.
Yeah.
So you're just leaning forwards?
Yeah. I lean on it. Or I can lean from this way. Yeah? Yeah. Should we start?
One more question.
Yes, of course, yes.
We focus on the muscles here and the muscles here. What do you tend to do? Do you, because this,
Around the knee?
yeah, or the patella side? So you just kind of do the.
I look for the
this
soft
way.
tissue around. So don't be afraid to go very deep and actually feel the bone.
That's all the ligaments all kind of
Yeah,
there,
exactly.
aren't they? So you just kind of pull them.
You can do that. This is a really nice area behind, very tender
They're
usually.
kneading and that one.
Yeah, back of the knee. And it could be
Yeah, that's
really rejuvenating. You can have someone kicking their leg when they finish the massage. So really nice. Yeah.
What about friction? Would it be?
Friction, there are two different types of friction. One is this one, which is fairly superficial. The other one is the friction that comes from compression. Very slow movement, because compression is stationary, isn't it?
Yeah.
And friction is just a compression, but you move it very little. Not like that. You move it minimalistic.
Why would you use one over the other? Doesn't matter.
Doesn't matter, really. Doesn't matter. Sometimes if I feel that it's harder, then I move it. It really doesn't matter. Doesn't really.
So the movement is slow when you include compression?
Yeah.
Is that right?
All the time. There is an inverse relationship between depth and speed. So the moment you go deep, you need to really go slow.
And do you do anything on the sartorius?
Sartorius is a muscle. It's very, very thin, and usually
Sorry,
you don't.
you know
You don't.
You know them all.
Usually you don't feel that.
Just wanted to say it.
Yeah. So it goes this way. If you have someone
that one in.
who you suspect a sartorius problem, then you go along the muscle. Yeah, more like that. But again, body movement is really important.
It's really good to do this though.
Yeah? Yeah, think muscles when you do it. And write it in your notes, in your massage note, because this is your revision really.
Yeah.
So what have you done in the massage? You think, oh, it's boring. Well, put the muscles and look for and connect. Mrs. John Sartorius, yes. Because you just remember her, associate it with people.
Joel, how do you know where to do compression on
I
a
don't.
muscle? You just
I don't.
wherever you feel.
I feel
it.
and I ask what they feel.
So you do it where you feel a knot or where you feel tension.
If there
Again,
is no knot.
it's either a knot that I feel, my finger by palpating feeling it, or they report that it's tender.
Okay.
This is what I do. Otherwise, it's very expensive to do compression because it's one place and it takes a long time. So I prefer to do that, expensive in terms of time.
Yeah.
I prefer to do a lot of more petrissage, and with the petrissage you feel it. And then you're coming to say, oh, okay, that might be, is it all right here? Yeah? Tender, okay. So you stay there. Can I go deeper?
Yeah.
And you continue. So don't make it a big deal. Just Petrissage. Is it all right, Amy? Oh, tender, okay. Compression, 30 seconds. You continue with the Petrissage.
And would you go back to that point?
Maybe. Yeah. Yeah. Seems like a good idea to do that, and then you come back to it. Yeah. So easier. Yeah. Shall we start?
Yeah.
Yeah. Good. Fantastic. Let's close.